Anatomical structure. First is you have to know the anatomy of the sternum. It consists of three parts. The top part is called the manubrium, the middle part is called the body, which is the main part, and the lower part is called the xiphoid process. Now this is sternum. Parasternal means on either side. So you are going to block on the either side of the sternum. That is very important. Next comes the rib cage. Rib from the spine comes and get attached to the sternum. The first 7 ribs are attached to the sternum and they are called as true ribs because they are attached to the sternum. The rib 8, 9 and 10 attached to the lower border of the 7th rib, and the 11th and 12th are floating ribs. So this 8 to 12 ribs are called as false ribs. 1 to 7 is true ribs and 8 to 12 are false ribs. Another important thing is the costochondral junction. Costal is rib, chondral is the sternum, and this is the costochondral junction. This junction is very important because certain muscle like external intercostal don't cross the costochondral junction, and similarly from transverse thoracic muscle it extends up to the costochondral junction only. So some muscles which are attached to the rib and the sternum is very important in giving the block. These landmarks are very important when you have an sonographic anatomy coming into picture. Now coming to the muscle part. Here you have the deltoid and the pectoralis major, and pectoralis have the clavicular head and the sternocostal head. Two heads are there, and there is serratus anterior on the lateral part of the chest. When you cut open the pectoralis major, now I have cut open the pectoralis major, which is the major anterior muscle on the chest wall. Here you can see the coracoid process on the upper part, and this is the subclavian muscles which is at the upper part, and the serratus anterior on the lateral part. And what is very important here is the cut end. You have the cut end of the pectoralis major, and inside you have the pectoralis minor muscle, and this is the external intercostal muscle. What is very important in this external intercostal muscle is it does not extend beyond the costochondral junction. That is very important. If you look at the cut surface after breaking open the pectoralis major, here you have the external intercostal muscle, which is the outermost muscle. Inside it is the internal intercostal muscle, and deep inside the internal intercostal muscle is the innermost intercostal muscle, and there is no separation between internal intercostal and innermost intercostal muscle except the neurovascular bundle, which is arranged in the form of vein, artery and nerve, and the nerve is located at the lower border of the upper rib. And external intercostal muscle and the internal intercostal muscle are separated by a fascia, but there is no separation between internal intercostal muscle and the innermost intercostal muscle. You have